Every human being needs to express their emotions. So for that, they need to communicate. They need to communicate a lot. How frustrating it is to be not able to express your simple wants and needs. Speech is very essential, so is the ability to speak fluently. Kuzuzampala and welcome to Dungtsho BBS. I'm Sonam Chiki and I'm your host for today. For this episode, we have a very special speaker with us. He is a speech pathologist and an audiologist. Welcome to the show, La.
Thank you, Sonam. I am Pelden Ongchuk. I work as an audiologist and speech pathologist at our National Referral Hospital. I had been working there for last 7 years. And I hope you enjoy this show. And then you get lots of information from me. And then I hope this show can advocate and educate most of the parents and caregivers.
Okay. So talking is one of the biggest accomplishments for a baby. So the first question is, what are the milestones for speech and language development?
So firstly, this speech and language hearing milestone starts from very beginning, like any other milestones.
Mm-hmm.
Speech milestones, the first thing is the birth cry. Mm-hmm. The birth cry, whether there is immediate birth cry or delayed birth cry, I think we can conclude or we get some information about the communicative skills of the upcoming kid or toddler from the birth cry itself. And for hearing sensitivity, we get the information by seeing the startled response right during at the birth time.
Mm-hmm.
So if we present them a loud sound, they will stutter.
Mm-hmm.
They will try to respond to the sound by giving a startle. So that means the child is having a normal hearing. But they don't know how to differentiate between two sounds at that period of time. But definitely the child is hearing a sound at that time. So during the birth, it happens like that. And milestones, it's well divided for first 1 year, I think we should get along with three classifieds. First 0 to 3 months.
Mm-hmm.
So the child can understand and hear to the sound by getting the startle. And child uses some sort of cooing sounds, just open their mouth and then vocalize something, but it doesn't mean anything to us. And while expressive skills, they have a differential cry.
Mm-hmm.
A cry when they're in pain is different from a cry when they want attention from their parents, or the cry, the intonation, the tone of the cry that when they are hungry is different from the cry, the intonation of cry when they are happy.
Mm-hmm.
So something like that, a differentiated cry will be there within 3 months of age. So while hearing and language is concerned, within this 3 months of time, I think the child is most probably able to get the difference between the voice of a male and a female. Mm-hmm. The response they make to the father's voice and mother's voice is quite different at this time. So this is how receptive and expressive at 3 months of age. So after that, from 4 months to 7 months, so we go to 4 months to 7 months. At 7 months of age, the child should be able to make a babbling sound, a sound like ba, ba, using something like that, pa, pa, or just a combination of some consonants with a vowel. So babbling sounds. First 3 months, cooing sounds, and then 7th month, it's a babbling sound. And hearing and language, receptive language is concerned, the child is able to understand and respond to the intonation of our own parents. You know? If the parents are angry and if they shout at the child is able to differentiate the intonation of that very conversation, and the child will respond accordingly. So that is how hearing is getting developed. And by the age of 1 year, the child is able to say first word. Maybe the first word can be amma or daddy or anything. For example, if you are a mom and if your kid is 1 year and then he looks to you and say amma, that is the first word. But if he sees somewhere a refrigerator and then say amma, that's not a first word.
Okay.
He should understand and then say. So hearing is concerned, as a hearing is concerned, the child is able to understand simple commands like just two-step commands. Give me, or take this, give that, or take more, something like that, within 1 year.
Within 1 year.
So broadly, within 1 year, we classify into 3 parts. But after 1 year, we just go on with 1 year to 2 years. So 1 year to 2 years, the child is able to say 1 to 2 words sentence, combine 2 words and build a sentence. But the grammatical, the syntax should necessarily won't be correct, but okay. And as hearing is concerned and language, receptive language is concerned, the child is able to follow a simple commands. Just one step command, go there, take it there, close the door, put off the light, put off the TV. So this one-step command they will follow, and then this is how it happens. And they will be able to point to the object or the body parts, just simple body parts, fingers, toes, eyes, nose, ears, after 1 year, 1 year to 2 years. So after 2 years, the child will differentiate between shapes, big and small size, colors for different colors, some functional words, very common words like come, go. They can construct a sentence by using the functional words. So this is how it gets developed. So after 3 years, then they combine all the 3 to 4 words and make a phrases. And as a receptive language, they enjoy listening to rhymes, singing a song, reading with the parents together, and so this is how their language is getting developed. As far as speech, 2 to 3 years, there is more probability of getting stammering and stuttering because they are learning more, and then the grammatical syntax and semantics, pragmatics, all those language, the features of language, they are getting mixed up with together during this period of time. So at some point of the time, the central nervous system are getting puzzled to reshuffle all those linguistic features, and then they tend to stammer at that time. Stammering happens at 2 to 3 years of age. So I don't think it's not necessary to discuss after 4 years, because most happens within 3 years of age.
The early 3 years.
Yes.
That's okay. So it seems like it's more like a two-sided effort.
Yes.
Okay. So how can parents encourage the toddlers? Some of the ways?
By seeing at the milestones, the normal development milestones, if the parents feels that there is problem with their child, I think they should definitely consult some of the professionals, and then or teachers, and then maybe they will get referred to us, and then we would be able to suggest them the right way to do by looking at the child's ability. But broadly speaking, I think all the child needs mostly stimulation, a verbal kind of stimulation, an activity stimulation. It can be a games, it can be a parallel talk. Just talk to the child. Even if the child is not able to respond to you, just give verbal output to the child, and then keep on giving a shower of vocals to the child, so that the vocabulary for the child is getting increased unconsciously. So some of the techniques that I would suggest to the parents, if they feel their child is having a delayed milestones for communication skills, I think demonstration to the child by using some picture cards or toys, and any playful activities can do it. Demonstration and modeling, And even if the child is not speaking, just go on speaking. That's what we call self-talk. And then, for example, you ask the question to the child. If the child is not answering, then you answer on behalf of child. And then if the child is making effort to, use the verbal mode of speech, then just reinforce the child. These are the basic techniques that the parents should be following while stimulating the child for the communication skills.
The next question is, how do we realize that a toddler needs help?
We should see the normal, we should compare our child's milestones, the language and speech milestones, with the normal milestone development. And if you feel the child is getting delayed from the normal milestones, then I think toddler will need intervention for the speech and language. And you should also consider the hearing sensitivity. If the child is not having the normal hearing sensitivity, definitely the child is going to lag behind. And if you are having a problem with the child with other syndromes, like affected syndromes like mental retardation, Down syndrome, attention deficit hyperactive disorder, and autism, all those kind of thing. If you see that your child is not growing like a normal kid, I think the toddler definitely needs an attention.
The case that we have right now is about a 7-year-old boy who cannot seem to utter a single word, but then he hears perfectly. So, well, what has happened here?
Actually, the child is having a seizural disorder. There is a history of the accurate speech of one word and a two-word combination before, but after seizural attack, again he loses the language and speech abilities. So hearing is normal, as concerned, the hearing is normal. We check the hearing for him, but it's normal. So, but while going through the examination, oral cavities, there was lots of drooling. There are drooling. The tongue movement of tongue ranges are not adequate, so he is not able to manage his own saliva to go to swallow. So that's why the drooling is there. So here, definitely, when the tongue is not at the range of movement, he cannot articulate. The main articulator in our speech is the tongue. So tongue goes backward, forth, and then it just the tip of the tongue touches to the dental part to make dental sounds. The back of the tongue touches to velar part to make back sounds, like ka, all those things, ta for dental sounds, and even the lip closure was not there. So bilabials like pa, all those are not possible for the child to give. Basically, it's not his receptive language, the hearing. He can understand all the languages, speech spoken to him, but it is his oral structure that is not supporting for him to express what he needs to. Because even for simple sounds like bilabials like pa, he is not able to do because lip closure is not there. So basically, before working on speech, directly working on speech articulation, giving the sounds and words, I encourage the parent, I give the home training to the parents for controlling a drooling and maximizing the movement of tongue and strengthening the muscle of lips for the closure, so that after the structures are well maintained, then the production of sound will naturally come, because he has the receptive language intact.
So it was because of the seizure that he was
It's
drooling.
because of the seizure.
So now let's talk about the inadequate expressive skills due to excessive use of electronic gadgets. Nowadays, a 3-year-old can easily use iPads or smartphones without the help of their parents. And parents often allow them to use it to either hush them or as and when they demand. So how much of an impact does it have on the growing children?
As far as electronic gadgets and iPads, TV, mobile phones are concerned, in this modern age, I think we are getting increasing number of delayed expressive skills, especially expressive skills. not the receptive skills. Receptive, they have the intact, they get the communicative skills from the mobile phones and other TV shows, iPads and all those things. But expressive skills, they're lacking behind because of all these things. There are so many, because we are getting those kind of kids in our clinic, I think they are not getting the proper play behaviors. They are not getting the time to play with open-ended toys. They are not getting the time to interact their own age group people, and the parallel conversation is not there. Their emotions are not answered. So there are so many things to learn from the real-world interactions in terms of developing communication skills. Like first and foremost thing is peer interaction and socializations. Whereas the gadgets, we call it one-sided communication. There is no part from your part. You don't have to say anything to the gadgets. Gadgets, they provide you everything. For example, see the cartoon. Okay, the child will see everything from the cartoon, and then there is no active part from the child. Assemble from this cartoon, that cartoon, and then they get shuffled. So maybe just like a language mix, they mix some information from two cartoons, and then they come with a new language, new words. So even we cannot understand. We are getting difficult to tackle with this kind of issues right now. And as far as receptive language is concerned, they don't tend to listen to their parents. They have an habit of segregating themselves from the social beings, go to some corner, look at the gadgets, and their time is gone like that. So I think the gadgets is making a huge impact to the developing kids, not just in communication skills, in everything.
So the key message is that we should get rid of the electronic babysitter.
We need to introduce what is coming up to the toddlers, because at 3 years of age, we don't show them any gadgets, but after 3 years of age, we supply them with all the gadgets available in the market. They become shocked. They don't know what to do. It's important for us to give some timing. Just use that gadgets as a reinforcement. For example, if you are playing with your kid, if the child is having a delayed speech and language, and if you are trying to teach the child, use the gadgets as a reinforcement part. I don't say just refrain from the gadgets completely, but
have limits.
Have to.
I believe that autism is not a disability, but it is a different ability. And understanding autism is very, very important. At least that's what I feel. So now let's talk about autism. What is autism spectrum disorder?
But it's a spectrum, actually. So some people, they will have the communication skills. Some people, they will have the socialization skills. Some people, they will have the normal, what the normal people they have, the spectrum disorder, people falling in spectrum disorder, they will also have all those things. But maybe they are lacking something else. So clinically, we observe the child with communication disabilities, not able to express themselves, not able to understand what is being said to them. And mostly they have their own language. Autism, they have their own language. They talk nonsense. We don't understand what they are talking, but they mean something. So when we don't understand, we don't know what to do. So they show the tantrums, they throw tantrums to their parents, at the clinician, and it's difficult to manage, really difficult to manage. And second thing is they lack a social interaction. They don't mingle with their peers. For example, if the child is 5-year-old, and then if he is asked to put in this early learning center, maybe the child is very dominant there and beating all the other peers, or maybe the child is going at the corner and then spending time alone. So he doesn't socialize at all. He doesn't know how to socialize. He has the different way of, his central nervous system has a different way of commanding him to do and get along, all those things. So socialization is another part of autistic spectrum disorder. And as far as language, speech is concerned, the autism will have echolalia. It's just echoing equally.
Oh,
This is the
okay.
typical feature of the autistic kid in speech and language.
And how are the speech and language problem of autism spectrum disorder treated?
Autism, when it's a spectral, every child is different. So some child, they must be having a receptive language near to normal or equal to normal. And some autism, they don't understand anything. Their receptive language skills are nil. They don't understand anything. So our plan, our speech and language stimulation plan will be different for every kid, because every kid, they are different. So if the child is, first of all, we assess the child, we relate the language and speech abilities with the normal milestones, and we see what can we do. If they are having a cognitive skills like the use of language, semantic skills, the grammatical, if they are having expressive skills normal, almost normal, but grammars are different, we focus more on syntax, grammatical parts. And then if the child is having a very poor receptive skills, by the way, receptive skill, almost to, if the child is 5 years and his receptive skills is near to 1 year, then we just focus on 1 year's milestones, and then we give the activities according to child's likes. For example, the child may like toys and picture cards. So we make the use of toys and picture cards at the most, and then give the home training program, home therapy messages to use all those things. And then we even direct the parents and program the activities, schedule the activities together. And we even ask the parents to use the reinforcement according to the child's needs. So basically talking about treatment and therapeutical management of the autistic spectrum disorder, we really need to assess the child thoroughly. It may take around 2 to 3 hours to assess the child's communication skills, and then each plan is different from other plan. So it's definitely individualistic plan.
But with the help, they can lead normal life.
Normal life, it's difficult for most of the spectrum disorders.
Before we move on to with another topic, there's this very bold person who'd like to speak with you.
I started at the age of 8 because during that time I imitated my friend. So with that imitation, it became a habit with me.
When do you stammer most?
There are situations where I get where I do a lot of stammering. When I get angry and when I get nervous, during that time I stammer a lot. Yeah, I want this habit, my habit of stammering, to be treated. Today I came here to do my speech therapy, so let me see how it goes.
Have you tried to consult a hospital or go to somewhere, get some help from anybody else?
I've often heard people say that stammering or stuttering is not a disease, but it is a phase, and we can heal it with dedication and with time. And also I've heard that there is no medicines for treating stammering. So so what is stammering, and who all are susceptible to it?
Stammering or stuttering, it's a non-fluent speech. It can be a prolongation of speech, the phrases, words, or the word repetition, the initial stuck of the word, what we call as initial word repetition. Then it can be with glottal stops. Then the tremoring of your lips and tremoring of your tongue. The result of all those motor speech structures led to stammering. And then another is neurologic stammering. It comes from the central nervous system, brain. So he is not able to shuffle in right syntactical way. So grammars are not correct, so he's getting hesitations. All this leads to the stammering. So basically, stammering is non-fluent speech. And for the adults, maybe due to the brain damage, stroke, stroke to the brain, or somewhere at vocal cord injury, and when they are having the apraxia, what we call the motor speech development, motor speech disorders. So adults are susceptible during that time, stammering.
And what are the causes for stammering?
Most of the people, most of the kids or child at their developing age, teenage people, they try to imitate to those speech. And once you imitate, twice you imitate, you don't know you are acquiring the same habits right there. But what happens is, in unconscious mode, you tend to get this problem. So that's how our teenagers get the habit to stammering. And second cause can be like stroke, and third cause can be tongue tremors and all those things. And neurologic cause, psychological cause, there are so many causes to be discussed, but broadly the psychological cause will have the anxiety and anticipating the behavior. Like if you feel like you're going to stutter at that word, for example, the word is school. So if you anticipate that word, I may stutter at school, then definitely you are going to stutter. So anticipation is another cause. And psychological cause, like if you are getting segregated from the social mass, if they think, if people treat you some little bit down, then you are susceptible for the stammering. All these things, psychological cause. Then neurological cause is like aphasia and all those things.
So look down means low self-esteem?
Yeah, low self-esteem.
Okay. Since there is no medications, what are some of the exercises or treatments available?
We give a set of exercise, all broad exercises, just relaxation techniques and breathing exercise, speech breathing, that's what we call. And the way the breathe in and breathe out is taken, and the way the vocalizations are made, if they're having the laryngeal tension areas, or if they are taking the chest breathing or abdominal breathing, we try to correct the right breathing way. We try to correct and relax the laryngeal tensions. We try to correct the tongue tremors, if this is mechanical cause. And if they are having a neurologic cause, okay, fine, we just go on with the relaxation technique for so many weeks, and then if they're having a good improvement, then we add other therapy techniques like prolongations and soft phonatory onset. We have so many other techniques, but that is also like individualistic. Every individual, they are different, even in stammering also, like just in autistic spectrum disorder. So by assessing each individual, our therapy goals are different for each individual.
Okay, so some speech disorders can be treated, but however, some speech disorders, they have permanent damage. So does cancer have anything to do with speech impairment, like a permanent damage or something like that?
Yes, speech can be affected permanently because of cancer. Just as an example of the throat cancer, where the whole larynx should be cut off, and then the vocal cord also gets involved there, and then it's gone with the cancer thing.
Thank you so much for your time, your effort, and your sincerity. We really appreciate it. We do. Speech fluency is very important in modern era. And if you have any problem, any teeny ones as well, you know where to visit and whom to meet with. Thank you for being a wonderful audience. I wish you health. Kadinchala.
Action, beautiful, action.
Action.
Yeah. For those who stammered, please come forward.